Hi, everybody. We are so excited to have you join us today. We have Dr. Scott Munsterman back with us again to address a topic of conversation that most in chiropractic did not think really applied to them. And now we have figured out it most definitely applies to us, especially during a global pandemic, and that is OSHA. So we're super excited about today's presentation. I could tell you all about Dr. Munsterman again, but y'all have heard me talk about how amazing he is for 3 weeks. So we will skip the bio today, but I just wanted to say that doesn't mean he's any less fabulous now than he was 3 weeks ago.
You sound like my mom, actually. Okay, that's good. Okay.
I'm gonna take that as a huge compliment because
that is a compliment, by
the way. Just a reminder that today's webinar is being recorded. Every one of you will get a link to the webinar recording. You don't have to request it. You don't have to send me an email, and I just hit share, so you should be able to get your handouts down below the chat box where it says files. For those of you who want a certificate of attendance, because you like to keep track of everything that you attend, that will pop up at the very end of the presentation, again, where you find your handouts. So if you have any questions, make sure you submit them throughout the broadcast. We look forward to answering all of your questions. Mm-hmm. Ladies and gentlemen, here we go. Mm-hmm.
Hi, this is Dr. Scott Munsterman, here to visit with you, actually ask you a question. Do you have a safe clinical environment? Because whether you have a safe clinical environment or not, to your standards or your thought process, your patients are noticing. They're noticing it today. And why is that? Well, with the COVID-19 crisis upon us, they have had many opportunities probably to visit different facilities, different businesses, and especially other healthcare facilities. And believe me, they are paying attention as to what is being done in that particular business and especially in that particular healthcare facility. And as we think about that, this whole situation largely caught the chiropractic clinician flat-footed. And quite frankly, as the experience that I've had being in compliance and working with clients and talking to doctors in the field, our colleagues, very, very, very few chiropractic clinicians have had or have OSHA guidelines covered within their practice. And so when it came down to infectious disease and with the COVID-19, that's one of the things that most practices did not have a clue what to do within their practice. And that's why we came out, ChiroArmor came out very quickly, very early for the profession to help provide guidance in this area. And we just thought it would be a really good idea to visit about that today. And what does your practice need in place in order to get and stay compliant with OSHA regulations? And so exposure control is one of the several things that we need to have in place when it comes to OSHA regulations. And the mission of the Occupational Safety and Health Administration is to save lives, prevent injuries, protect the health of American workers. And they do that under what's called the General Duty Clause, Section 5A1 of the OSHA Act. That was developed in 1970. All right, and so it dates way back. And of course, the OSHA jurisdiction covers all employees. And so if you think, well, I don't have enough people for OSHA to have to worry about OSHA, well, you're wrong. You have one employee. You've got somebody that you need to make sure that you are protecting and keeping a good, safe workplace environment for that individual. And keep in mind, true volunteers are not covered. These are people that are compensated for work being done. And of course, just to give you a little bit of information about OSHA before we dive into what it is that they would be regulating within your practice facility, is that there are two sides to OSHA. There's the enforcement side, or what you could say they wear the black hat, and they're into the regulatory compliance, the fines. That is not confidential, by the way. I mean, if they come in and do an investigation or are looking for anything or maybe following up on a complaint, that is not confidential. That is all a matter of public record. But they also have a business side, which is a helping business side, which is called consultation, OSHA consultation. And that's if businesses want to voluntarily comply and seek an exemption status. And of course, there's no fees or penalties if they find something wrong with your facility, and that is kept completely confidential. The OSHA consultation programs typically are run by state, and the resources that we will provide for you on a download that'll give you some guidelines for where to go after this workshop. You can go ahead and find out where your state office is, and you can certainly visit with those folks and see what they have to say about helping you overall with your OSHA program. They are very focused and on a single purpose, though, and I will tell you that they won't like set up your complete program for you. It's more of a specific question type of a response by them, but it's a resource that is there. And so what brings in OSHA enforcement to inspect your place of business? Well, if they feel that there is imminent danger, or if there's a catastrophe or fatality, they need to investigate immediately. They follow up on complaints and referrals. If there's been any accidents, amputations, and then they also have a programmed inspection. So it's kind of like spin the wheel, and let's see whose office, whose business comes up on the wheel today. And they move forward with those types of inspections. And of course, as I mentioned, complaints and typically complaints by employees is what will trigger an OSHA investigation. And of course, in Section 11C of the Act, it provides that you cannot fire an employee who has filed a complaint. So what happens if they do pound on your door? Well, first of all, you can do one of three things. You can just let the inspection proceed. They'll typically show up, show their business card, and say, I'm here to inspect your place, and you can just go ahead and allow them to do that right at that moment. You can ask the inspector to wait, which is what we recommend, and that gives you ample time to get your records together, get your policy together, call a quick huddle or a powwow with your staff and say, okay, everything in order, here's our policy, all of that. Or you can require a warrant for them to proceed. But either way, no matter what way that you go with this, they will be inspecting your facility. And of course, if you go to this link, you can catch up on the latest on OSHA fines. They do fine offices if they do not find policy, if they do not find that regulations are being kept up on. And so the question is what does my practice need in place? And again, at the end of this module, we'll talk a little bit more about how you can get your hands on our guidelines. We've created a guideline approach for you, and it has active links so that you can go do your research and build your policy. But let's talk about some key policy considerations, because there are a number of key areas that we need to make sure that we have in place. And so what we want to do here is take probably about a 10,000-foot view of each one of these and talk a bit about them. And of course, first and foremost, OSHA looks for leadership commitment. They want to know that your business is serious about safety and health for workers and for your patients as well. And so they'll be looking for your annual evaluation. They'll be looking for what types of responsibilities and how do your key people have within the business. Do you have notifications? Do you have signage? How does your staff participate within your business, and how is that led when it comes to training? Is there a clear procedure for reporting incidents, that type of thing? Do you do your hazard assessment? I mean, is it carried out? Are these different areas within the policy carried out? And they want to see that that owner of the business is being responsible and providing leadership to the practice and has a strong commitment to safety and health. Record keeping requirements, and of course making sure that you keep track of your training, make sure that if there are medical records within the personnel file of the employee is what we're talking about here, to make sure that that is kept up to speed, and especially if there's any exposure to like bloodborne pathogens, which we'll talk about in a minute, or maybe the airborne pathogens like the COVID-19, and and keeping track of those types of things that may happen to employees as time goes on. And of course, the OSHA 200 forms to make sure that we have record keeping in terms of injury and illness. If you are using acupuncture or doing labs, having a Sharps injury log. And so there are specific record keeping requirements that we have within our practice to keep up to standards within OSHA. And then exposure control policy. And this is what caught many doctors, chiropractic clinicians, flat-footed. They didn't know how to handle that. They didn't know what to do. And of course, laying out a step-by-step approach of making sure that you have personal protective equipment, making sure that you are practicing proper hand hygiene, environmental cleaning, that terminal cleaning, all of those things are so important. And then, of course, having exposure management and training, staff training, and then categorizing the risk that you have as a healthcare worker, as well as what is the return to work policy if somebody is infected, is off work, and then comes back on. And of course, with the COVID-19, as we've shared in previous modules, and we're not going to get into that in detail today, but I would just recommend that you go back and if you haven't already, watch our modules. We've got 3 great modules on COVID-19 and how to get your practice prepared specifically for this particular infectious disease. And it's all about standard and transmission-based precautions. And of course, OSHA talks about standard precautions, and CDC, as we've referenced in the past, talks about standard precautions. You've probably heard of universal precautions. They all mean the same thing. And what is that? Well, it means that we assume that every person is potentially infected or colonized with a pathogen that can be transmitted in our practice setting. So every patient that walks in, we need to assume that they are potentially infected, okay, and that they're carrying a pathogen that could be transmitted to you, to your staff, and to other patients. And so keeping that universal standard precaution in mind, that causes us to think about, okay, now we need to take necessary precautions within our practice. And so whether we're talking about bloodborne pathogens or airborne pathogens, keep in mind that these standards apply to the chiropractic practice. So let's talk a bit about bloodborne pathogens. And of course, they're infectious microorganisms in human blood that can cause disease. And some of the more common ones that of course, you're probably very familiar with hepatitis B and C and HIV. And of course, needle sticks and Sharps-related injuries have the greatest risk exposure to bloodborne pathogens. But keep in mind that it's not just human blood or blood components that could be transmitting this infectious material. Also what's called potentially infectious material or other potentially infectious materials, meaning that other body fluids like semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, pericardial fluid, peritoneal fluid, amniotic fluid, saliva, any body fluid that's visibly contaminated with blood, and even body fluids that you may not be able to see it with the naked eye, any types of contamination of blood, but it could actually be there. And so it's any fluid that comes out of the body could transmit an infectious material. And again, as we talked about, what are the greatest exposures we have within the chiropractic clinic? Of course, needle stick if you're practicing acupuncture, drawing blood, but then also other potentially infectious materials, body fluid. And so again, saliva, all of those other body fluids that could come into play. And guess what? In those events, we need an exposure control plan that operates very similarly to airborne pathogens and having the appropriate training that would go along with that. So very key, very important. You think, well, Scott, I don't use acupuncture and, we're not going to be that exposed to saliva or that type of thing. We clean our tables. Well, and I don't really need a policy on bloodborne pathogens. Well, frankly, you do. And in a large degree, so does a construction company. And you may think, what? Well, yes. And so small businesses need bloodborne pathogen policies. And again, OSHA takes this extremely seriously when it comes to other potentially infectious material. So let's move on. Let's talk about safety and ergonomic hazards. And of course, the safety hazards that we typically think of, or we should think of, would be those that are identified like as trip hazards, electrical hazards, maybe some unsafe things that are in an old office building that, with fuses and how things are set up, as well as stairwells and do you have uneven surfaces within your facility? Those types of hazards are what we are talking about when we talk about safety hazards. And of course, there are poster requirements, and many of us have heard about the poster requirements both on a federal and a state level. Well, just to make sure that we help you out in this area, you can go right to this active link right here, and that will bring you into a federal site that has samples of all of the required federal posters. Okay, these are federal posters that are required to be hung in your practice in an area where your staff can see them. All right, so I just want to make sure that that's very clear. The next thing on your list, after you download these posters and save yourself thousands of dollars, all right, literally thousands of dollars you're saving by doing this right now. Also go to your state Department of Labor and find out if there are any other state requirements that you may have. Some states don't have any other poster requirements and others do. They may have a different minimum wage act, so on and so forth. So keep in mind, number one, download these, get them hung up, visible spot for employees to see. Employees, that's who needs to see this. And then secondly, go to your state Department of Labor and download those poster requirements and posters that are necessary for your state as well. Ionizing radiation, and of course, X-ray, if you have an X-ray facility within your clinic space, and it's whether it's you and or a staff person taking the X-rays, and especially if it's a staff person taking the X-rays, you need to protect yourself with policy, and you need to protect that healthcare worker with policy. And so that means using dosimeters. That means getting your quarterly reports and reviewing those quarterly reports, making sure that you're documenting for two reasons. Number one is safety of the healthcare worker. We don't want to see you or your staff person receiving too much dosage of X-ray. Secondly, though, would be your liability as a business owner. If that healthcare worker works for you and is taking X-rays and you are not monitoring with a dosimeter and getting those quarterly reports, that person works for you for 5 or 10 years. 10 years later, they show up, they have cancer, and they're blaming you because they feel that they've got overexposed in your clinic. What do you have to back yourself up on that? Nothing, unless you have a policy and you are doing the dosimeter readings. And so very important for those two particular reasons. Number one, safety of the worker, hands down, need to do it for that reason alone. But secondly, liability of you and your business. And then we have a very little known program called the Hazard Communication Program. It started out as the Right to Know. And you say, Scott, what does that mean? Well, it means that OSHA felt it was important for workers to have the right to know the solutions and the materials that they're working with from the standpoint, are they at risk? Is there something within this material that will cause risk for me? Meaning that, okay, is there hazard? Is there exposure to the hazard? And then how much risk is there? And so a hazard refers to those inherent properties of a chemical substance that make it capable of causing harm to a person. Exposure describes the amount or frequency, kind of like a dosage of that particular substance that you come in contact with. And then the risk is the possibility of harm arising from the amount of exposure you have to that hazard. And that's what we're talking about with risk. And so everybody needs to be able to know, okay, what is it that I'm using? What's the hazard? How often do I need to use it? And what's my risk of it harming me? That's what Hazard Communication Program is all about. And of course, what we're looking for here are those products that we utilize within the practice, not something that you would get at a retail store and use in your house. If you're doing that and you're using it the same way in your clinic as what you would use in your house, we're not talking about those chemicals, but what we are talking about are those list of hazardous chemicals that you maybe special order to clean the tables, or for instance, the professional grade lotions and pain relieving gels and those types of things, the ultrasound gel. Those are all things that have a safety data sheet, or what's called a material safety data sheet. And those are very important to obtain. And you can typically go right on the website and download them and then train your staff on what the hazards of those particular chemicals are. Very important. And of course, they come with labels, hazard communication, again, identifying that hazard, communicating to the staff what that hazard is, if any personal protective equipment needs to be done, and then of course making sure that they are trained appropriately. And speaking of training, safety and health training on all aspects is so important. And then following that up is the annual hazard assessment certification, and that's similar to what we talked about just briefly when we talk about safety and identifying hazards. I mean, it's everybody's responsibility in the practice to identify hazards, number one, first and foremost. But every year there needs to be a walkthrough, and there needs to be a safety assessment that's performed and then signed off on by the owner or by that individual that performed that safety assessment. And of course, again, looking at all of those key areas, stairways, stairwell, elevated surfaces, exit doors, the ergonomics of the place. We didn't speak much to that, but many chiropractic clinicians are very in tune to ergonomics. Your therapeutic modalities and equipment, do they all work? Do you have instruction manuals in close proximity to the modality? Very key, because that's one of the first things that OSHA will look for. Emergency action plan, again, the different areas that you need to have policy. And then if there is something wrong, if you find something wrong, what have you done to fix it? And so that's what hazard correction and control is that if you have an area that you have exposure, that you have risk towards a hazard on, then what are you doing from an engineering perspective? Can you fix anything to control it? Or from an administrative perspective, how can we train? How can we do a certain workflow that will minimize the exposure, if you will, and therefore the risk to that hazard? And then, of course, emergency disaster policy. What is your emergency disaster policy for lots of different types of activities that may happen, whether it's fire, whether it's a bomb threat? What about loss of critical utilities? What about a cardiac arrest in the office? What's your protocol for that? How about a tornado or severe weather? Terrorist threats. What's your security plan for your facility, your clinic building? What's your backup plan for just your business records? I mean, we haven't even talked about HIPAA, and the backup requirements that goes with PHI. But what is it that you're ready for, if you will, if a disaster was to happen? Well, having a policy in place that addresses all of those areas is so key. So getting and staying compliant with OSHA. I mean, research and develop policy, implement changes in your practice, train your staff, and then follow and monitor your plan. But the key part here is research and develop that policy. You got to have a place to start. And one way to do that is to go ahead and click on this link. It'll bring you right into a self-evaluation tool. And that will help you walk through what does OSHA look for, and then what do I have in a policy. And so you lay your policy on one side and you look at the checklist on the other. They also have what's called an implementation checklist to track those action items that you've completed during that whole process. And then also they have an audit tool that you can also utilize to help identify any weaknesses that you might have within your practice OSHA policy. And just wanted you to know that we typically, our clients, if they come on just strictly for OSHA, we have a fee that we charge for that program, and we help individualize their program for them, and we carry it out on an annual basis with monitoring and auditing processes that go along with developing the policy for them. And our regular rate is $14.99, but we do believe that because our profession is largely flat-footed in this area of OSHA and infection control and exposure management and all of that, we want to be able to provide a special COVID-19 offer for a very, very limited time. And so take that under advisement if you like. We do want you to download this free guideline for your practice, and that will help lay out the steps that you need to be looking at in terms of putting something into place. There are active links for you to go to that you can begin to research and develop your policy if you'd like to spend the time to go ahead and do that. But certainly this is such an important area for us to create that safe, clean clinical environment and to shore up this area within our practice. I was just to kind of close this workshop, I was visiting with a good friend of mine, Dr. Steve Conway, and we were talking a bit about this, and he said, it's kind of that come to Jesus moment, where you find yourself in a situation that you've never been in before, and it's like, boy, I was not very prepared for this, and you realize it, and then depending on how you act out of that, if you say, I'm going to get my act together, I need to get this done, then that would be a come to Jesus moment. So it could be that you may be having one of those right now, or may have already had it, and now you're wondering, what do I do? Well, this is a great place to start. And certainly feel free to join us again. Give us a call. We're happy to help. We love providing this information to you. We have a strong lineup of resources, ChiroArmor, and looking forward to visiting with you again very soon. Again, any questions or comments, we're all ears and would love to visit with you. This has been Dr. Scott Munsterman with ChiroArmor, wishing you the best in practice success. Take care.
Oh, got to turn on my audio. Whoops. Okay. So if y'all have any questions, a couple people wanted to know how to access all the links, and I made sure that they were downloadable in handouts under files, which you should see under the chat box. There's also an offers tab you can click on that will take you directly to, right now, it is the toolkit offer. And Dr. Munsterman, can you tell them a little bit about what that entails versus the DIY, which is the free OSHA guidelines?
Yeah, and so what we did with the download that you can get for free, it's a guideline, and it helps walk through what are the areas that you need to have developed within your practice from a policy perspective. I mean, everything starts with policy. You've got to lay that out. And what we did is we created links that'll bring you right direct into OSHA's website. They have a lot of really good resources there. Of course, I use them. But you'll have to take the time to go into that link and do all the reading and kind of bring everything together and write yourself a policy. But that guideline gives you some direction, where to look, what to follow. They've got some useful audit tools and implementation strategies. And of course, it's designed for all businesses, not just healthcare. But again, it should get you started in the right direction if you want to do this on your own. And Christy, and then as you know, we were able to bring our consulting product into more of a DIY, if you will, with some virtual help that is also available at a I think probably a pretty good price, but that will be for a very limited time. But certainly we wanted to get information into your hands. Again, we feel very strongly this is an area that just really needs to be shored up in our profession and in our clinic systems. So hopefully it'll be helpful for everybody.
Absolutely. And so if you've already downloaded the handouts for today's webinar, which includes all the links that Dr. Munsterman talked about, make sure you still go to chiroarmor.com/OSHA and download that white paper, because it is a little bit more detailed, has a lot of links in there for you to be able to download and access that information to build out your own policy. And again, if you're not a DIYer, because I'm not a DIYer, so then definitely check out the OSHA toolkit. Is it $14.99 or $149? And the answer is it is $149. We're offering a 90% off discount on it right now during the COVID-19 pandemic. But it normally is $14.99 when clients purchase it.
Mm-hmm.
So, do we have any other questions? Anybody? Lots of stuff. Yes, Julie, I saw your email, and I am emailing you right. I saw your message, and I'm emailing you right now. Let's see. The link has it at $14.99. It should let you just hold on. Let me pull it up and see.
They have a coupon code that can be used. COVID-19 is the coupon code.
Oh, COVID-19.
Yep.
I'm gonna just see what happens when I play with it. And coupon code. See. Oh, it sure does. And there's no dashes or anything. I'm fixing to post this link. Mm-hmm. Use coupon code. Just type it like that because I just did it. Did it go out there? It did. I typed
and that'll give them the 90% discount. It's hard for me to say that. But we're doing this for the profession, right?
Absolutely. Okay. So again, I'm going to post this in here. If you will click on, for those of you here trying to download the handouts, if you look just below the chat log, it should say files. And there's another tab that says offers. And if you click on that, offers will take you straight to the toolkit. If you go to files, you can download the handouts for today's webinar. And then if you want the white paper, it is chiroarmor.com/OSHA, OSCHA. Let's see. How long is this offer good for?
It may not be good past 10 days, but we will see at that point. We want to give you some time to try to do it yourself. I mean, literally look at the guide. You know, we're not trying to push anything, make you make a fast decision at all. But, you know, I don't know if it'll be available after that point in time, but, you know, we'll certainly talk about it internally. But we want to be able to get you information, have you, you know, do the work yourself. If that's what you're inclined to do, you know, that's great. That's why we're having this conversation. And then that'll give you some time to see what kind of work is involved with doing it yourself and be able to go from there. So I don't know how to answer that any better than that, Christy.
So we have a question that says, can you expand in the safety we should follow with the current pandemic?
Yeah, and so I would recommend that you watch the 3 videos that we've done specifically on COVID, because we've covered in good detail exposure control for that airborne pathogen. And you know, the 3 different areas within the strategy, the COVID-19 strategy that we've talked about, you know, your clinic facility and patient care, and then of course our public health, you know, response. And so it covers it very well. And I'd recommend watching all 3 of those videos, and they're available on our resource page as well. So
they are. And again, if you go to chiroarmor.com, chiroarmor.com, at the very top of the screen, it has all the links to, you can go back and see what upcoming webinars are coming up. You can download all of the handouts, white papers, go back and listen to the recordings for every webinar that we've done in the last couple of weeks. And any new ones that we're going to be doing, because we post new ones usually by Friday or Saturday for the upcoming week, will also be listed there. So make sure you check it out. And you can also find them at ChiroHealthUSA.com under the COVID-19 page. Is there anything new that we need to know about the CARES Medicare payout?
No, just make sure that you read the, you know, the agreement that Medicare has put out there. It would appear, you know, to us, and of course, I know that there's still some legal review that's being done on that document that came out, but it would appear to us that, you know, that chiropractic clinicians do apply towards that. Just with the way that it's worded. But until that final review comes out, at least on our side, we'll probably have more to report on that probably within the coming week. But our recommendation right now is just to kind of sit on that money that you got in your account and just kind of wait to hear from us and wait to hear from maybe your state association attorney, lobbyists, those folks, and get some clear direction that that it's okay to proceed as that you would be an eligible provider. Again, I probably 90% sure that we are, but we want to cross that T and dot that I. And until I hear from our legal team that, yep, we're pretty solid on that, then that would be a go ahead.
Okay, let's see. I think that is everything. So here's what I'm going to do.
Good.
I'm redirecting y'all to the ChiroArmor.com website. Boom. Let's see. Did it work? Because y'all know I'm watching this on multiple screens. And I just found that that's a new feature that I can do. What? Okay. Oh, it worked on mine. Okay. So, again, ChiroArmor.com. If y'all think of any additional questions afterward, just hit reply to your reminder email. It'll come to me. If you are watching this webinar recording and you post a question in the chat box, it emails it directly to Dr. Munsterman and his team at info@ChiroArmor.com. And they are so quick to respond. So just remember, we are handling a lot of COVID-19 questions and answers these days. So please, give us at least 24 hours to respond to you. So thank y'all. We'll be posting a new webinar soon, and we'll see you next week.
Thanks, Christy.
Bye.